Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health. Welcome to A Mindfulness Experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The GW Office of Integrative Medicine and Health promotes integrative medicine by providing learning opportunities to health professionals and healthcare consumers. Today's facilitators are Arlene Pericak and Dr. Billy Mullins with the GW Nursing and Sage Rain Dancer of Rain Dancer Healing Arts. And he is a certified nature and forest therapy guide. Dr. Kogan's also going to be here to answer any COVID-related questions. And a quick reminder, if you have a pet, we'd love to have you go and grab them for this next wellness talk.
Great, thank you so much. Really appreciate it. So yes, my name is Dr. Arlene Pericak, and we have Dr. Billy Mullins here, and we're delighted to be here to talk about pet therapy. We actually talked to our students about pet therapy, and it was great seeing students on Zoom with their pets in their lap. So we hope to get an opportunity to see your pets as well. So there's a lot of benefits of pet therapy. I know all of the owners here of pets can certainly agree with this. But in this session, we're going to talk about and highlight the effects of the physical and mental effects of having a pet. We're going to also touch on maybe some special groups. And we're going to talk a little bit about volunteering with your local pet agencies. And I'll talk a little bit about some of the fostering that I've personally have done. So we know that owning a pet is great. And do we see people with their pets here? Let's see. Just going to look down. Oh, there you go. There you go. Okay, very good. So if everyone has their pet, if you want to take this opportunity to stroke or pet your pet, okay. So take that opportunity to do some petting. And did you know, as you're stroking your pet, that's you getting some hormones released that play a part in elevating your mood and actually elevating your mood. So it's good. And so you're petting your pet and you're getting a release of serotonin, prolactin, oxytocin, and these are all play a part in elevating your mood. So hopefully after this session, you're going to feel happier. And not only does a pet increase our moods, but it also decreases anxiety. So, it's very common for people to have pets to help with loneliness, right? Stress and anxiety, and just in general, make them feel relaxed, right? And so what happens? The animals decrease our anxiety and our sympathetic nervous system by providing a pleasant external focus for our attention. So it kind of redirects our attention to the animal, and it takes away from our elevation or arousal of that sympathetic nervous system. You know, by the way, heart patients, their anxiety ratings drop 24% when visited by a dog and human volunteer in a hospital. So I think that's really pretty cool. That really made a difference for them. And also epinephrine, that is a hormone that our body makes under stress, that actually drops 17%. And there's some research on that when people were visited by a person and a dog in a hospital. So not only does a dog decrease, and this, by the way, is my daughter. She fosters dogs, and I'm the foster grandmother. I help her with the dogs. This is a picture of my dog who was no longer with us, but Charlie, he provided a lot of comfort for me and later on for my daughter. Pets that are very friendly, again, they decrease, the hypothesis, they decrease anxiety and the sympathetic nervous system. And, it provides us to really put our attention and get a feeling of safety and provide a source of comfort. And this is actually research that has been done. So this is Charlie here. He was a King Charles Cavalier, and he certainly provided me with a lot of comfort. And then my daughter talked me into giving him to her, which I did, but I, of course, miss Charlie. So Billy is going to be talking about loneliness and the effects of how it can help with loneliness.
Thank you, Dr. Pericak. Yes, as many of us can attest to this feeling over the past and a half due to the pandemic that we've been living in and the social isolation that we've been experiencing. Loneliness is definitely an emotion I think that many of us have an unfortunate connection with. And what we know from the literature, and even if you've owned a pet before and now you do not have a pet, then you can feel, there's a void there that needs to be filled. So animals have shown to make former pet owners who live in nursing homes feel less lonely. And so that's why you see that there's a lot of like pet therapy associated with long-term care facilities, because they help reduce some of those voids and some of that loneliness that's experienced from the people that are living in these residential facilities. And it's because, pets are an integral part of our lives, and many people, we grew up with pets and we feel that they're missing once, they're not present with us and part of our lives. And so research does show that what we've always suspected, that the ability of pets fills that void and helps decrease those sensations of loneliness. In addition to that, it also helps decrease boredom, feelings of isolation, alienation. So it helps us feel less lonely and also helps us feel less depressed. It can increase our mental stimulation, which would assist us in recall of memories and help sequence temporal events in patients with head injuries or chronic degenerative diseases of the brain, such as Alzheimer's disease. It promotes feelings of safety and providing a source of comfort, has been supported by much of the research conducted to this date. It's shown to decrease agitation in patients with Alzheimer's disease. So Alzheimer's patients who have pets in their home, they're less likely to suffer from outbursts of anxiety or agitation because of the presence of a pet. And then also for like homebound patients, it's also shown to decrease the use of medical services by having a pet located in the home. Next slide, please, Arlene. Physical health. So pet therapy also helps with lowering blood pressure and improving cardiovascular health. So I'm going to share a personal story because I'm half Irish and I like to tell stories. So today I actually, for the first time since the pandemic, I went to have my own health physical and my blood pressure was amazing. It was 100/60. And usually my doctor will ask me, are you feeling okay? Your blood pressure is a little on the low side, but he didn't ask me today because he's now familiar with me and knows that, I do have two dogs and they do a good job in helping with my physical health, obviously, because I had a really good blood pressure today. And so in addition to my personal experience, there is a study of 48 stockbrokers with high blood pressure. And so there's a group that adopted a pet, and that group had a significantly lower blood pressure reading in stressful situations compared to those who did not have a pet. So it does show that there is some correlation with pet therapy and blood pressure. And then Arlene talked already about, how having a pet does help with cardiovascular disease. So pressure in the heart's top left chamber can drop by 10%, and pressure in the pulmonary arteries by 5% when heart patients were visited by dogs during their hospitalizations. Pet owners are shown to have a higher 1-year survival rate following a heart attack as compared to those who don't own a pet, as well as lower cholesterol levels. It also can reduce the amount of medications that people need. So another study, it was a multi-state study, found that medication costs had dropped an average of almost $4 per patient per day within some of the nursing home facilities where animals were included in the environment that was there. In addition, pet therapy can help with our breathing. It slows the breathing and anxiety, releases the hormones that Arlene was talking about earlier, diminishes our overall physical pain. And it's also good for those wonderful animals too. So pet therapy is good for us, but it's also equally as good for them. And I don't know if you've had the opportunity to be inside a hospital and a hospital that offers pet therapy to patients, but as a nurse, I've experienced patients having pet therapy, and you can just see their faces light up when an animal walks into the room. It like brings them joy just to have the physical presence in the room with them. There's also, for those of you who have the opportunity and like to watch television, I love the ad of the small girl in the hospital bed, and the nurse comes to the door, and the young patient says, "More treatment," and the nurse is like, "We're going to do something different today." And she brings in this dog, and the kid's face lights up because it's a different form of therapy that day. Yes, someone sees it too. Thank you, Jacqueline, for sharing in that commercial with me. But I love that commercial because it's so heartwarming, and it shows how important pet therapy can be in the recovery and treatment for our patients. And so the stress hormone cortisol is decreased when we engage with animals. So numerous case reports have described individuals who were in a catatonic non-responsive state, either from a stroke or other related conditions, that somehow connected with the pet that was brought in, to the extent that there were smiles and simple gestures that became evident. Severely withdrawn pediatric patients who started communicating with adults after touching or playing with their pet, and a decrease in blood pressure, which we talked about, and decreased use of antidepressants and decreased use of medical services have also been seen there as well. And so some other helpful pet connections, which is on our next slide, thank you, Arlene, is I can share a great story that I was talking with Jeanette about before we started our class. And after the events of January, there was a lot of presence of the National Guard in our city. And I live in the Capitol Hill area of DC, near Lincoln Park, which was one of like the camping staging areas for about 100 of the soldiers on a daily basis. And so I made it a daily routine to walk my dog to the park to provide some pet therapy to the soldiers. And I could really see how it really helped their day be more engaging and bright with them. One of the soldiers even got to the point where he was bringing treats in his pockets and giving them to the dogs every day, because he was just really happy to be engaging with the dogs, and I could see how it was making their time there less stressful for them based on the situations that they were experiencing. But in addition to that too, dogs and pets can bring a calming presence, and for people who are victims of violence or crimes. There are some instances where dogs can be brought into the courtroom and have reported to give individuals a feeling of having more control over their circumstances. It's presenting a non-threatening presence, so victims who may find it difficult to talk about their experiences become more comfortable now talking about their experience. Defense attorneys can use dogs in the courtroom to their benefit. Instead of grilling a victim, they work with the dog and the victim during cross-examination, so they can provide comfort without provoking sympathy from jury or making the individual feel childish or using the dog as a toy. So not all individuals need the dog to be within arm's reach for the therapy to be effective. Just having them in the courtroom present can be therapeutic. Okay, next slide, please. And back to you, Dr. Pericak. Dr. Pericak, you're muted.
This is a picture of my daughter. She actually took my little dog from me when she was finishing school, but she was here when we talked to the nursing students and talked about her experience of fostering dogs. And I personally don't have a dog. I'd like to have a dog, but I don't. But what I do is I help her foster. And so I consider her a foster mom. This is her in the Virginia vineyards with her husband and 2 dogs that she fostered, and then she ended up adopting. So the beauty of fostering dogs is you do get an opportunity to see if you do want to adopt the dog. But my daughter, as I said, adopted these 2. And I would say in the last year, especially during the pandemic, she probably fostered about 15 dogs. So I was a very active grandmother during that time. And you can see the dogs are exhausted from me walking them. But anyhow, because my husband is not a dog person, I'm able to do something a little bit different to kind of get my fix. And I help, foster dogs. So I recently moved down to Florida. These foster dogs are in Virginia, but I look forward to it. This reminds me I need to get active in fostering or even just walking dogs at a local pet agency. So I want everyone to get an opportunity to talk about their dogs. As I said, my little dog Charlie helped me during my time that I was getting my doctorate up in New York. And here you can see a little picture of Charlie. And I did treat this dog like a baby, I'm going to admit. Here he is going camping with me. So we did a lot together. And here's Dr. Mullins with his dog. And so, Dr. Mullins, did you want to talk a little bit about your dog? And then certainly we want to open it up to other people on that they can show us their dogs and tell us a little bit about their dog and anything you'd like to say. We'd like to hear. Thank you.
Thank you, Dr. Pericak. Yes, and I have to, confess that this picture was taken when I hadn't shaven, so apologies for that. But I was sporting the GW logo T-shirt there, so we'll go with that. But this is my oldest dog. She's 5. This is Bella. She's an Australian Labradoodle, so she's a combo of Cocker Spaniel, Lab, and Poodle. She's about 30 pounds. And when I'm sitting on the couch, which is where I am there, that's her typical space. She's usually on the couch behind me with her self wrapped around like a little stool. Sometimes I can be in a Zoom meeting and people will be like, private message me, is that a dog behind you? It is. It's my dog. She's a sweetheart, love her to pieces. And then we recently got a new one that is kind of inherited. This is Carla. She is a Maltese. She's 4 years old, and she was my husband's boss's dog, and she passed away this spring, and the dog has come to live with us, and she's adjusting and liking her new surroundings very well. So yeah, if you have a pet you would like to share with us, please do. And also be mindful that if you like pets, but you're not in a situation of being able to own one because maybe you're living in an apartment and it's small, or they don't allow pets, or you don't have the time because of work or school or whatever, there's so many great ways of being involved to help with pets. Thankfully, the shelters don't have as many now because of COVID. People were getting bored and went out and got pets, but there's a lot of shelters that offer different programs that you can be part of, such as going to walk for a pet, maybe going and sitting with a pet for a little while. Some programs have like weekend opportunities. We can take the pet for the weekend. So there's a lot of different options out there for you if you like pets, but don't have the ability to be a full-time owner. Oh, puggles, those are so cute. I love a puggle. Are you able to show us your puggle?
See her? Can you see her? Can you see her?
I'm scrolling
Can you
down.
see her?
Yes, Monica, we can see her.
Oh, so this is Lulu.
Where is she?
This is Lulu the puggle. Can you hear me okay?
Yes.
Oh, good. Okay, this is Lulu. She's 6 years old. She's a rescue.
Lulu.
She's half of a dynamic duo. Her brother is a rescue beagle. He's sound asleep because the 2 of them had a very fun play date with one of their dog friends this morning. And they're excellent companions. They have helped us through a lot, and not least of which is this last year and a half during the pandemic. their most recent adventure has been trying to eat their body weight in cicadas. So we have to try to limit their time outside. But they're really excellent companions. And they love this mindfulness session. They love whenever they hear any kind of meditation coming on or anything like that, they come running and she just did it. They do a big sigh and they lie down and they meditate.
No, I don't see it.
Thank you for sharing, Monica. Love your dog.
Yes, thank you. Such a cutie. I love that face.
I don't have a dog.
I'd like to tell you about my poodle. I don't know if you can see his picture.
I can. He's posing
Yeah.
here.
Yes, he's well, that's a picture of him. I'm not very adept at, anyway, aside from that, I will tell you he's a big boy. He's a standard poodle. And though we don't need his service, we have taught him to push the walkway button. To make the not the walkway button, but the button for the crosswalk, so that he will push it and we'll wait and we'll cross. So that's what he's been trained to do. He has also been trained to sit. When I stop, he will sit right next to me so that I don't need him to hold me up, but he's able to do that. So it's very exciting that he enjoys having tasks to do, and my husband and I enjoy teaching him to have his service tasks. It's good to have him.
Thank you for sharing. He looks beautiful, and I love how he's posing for you to take his picture.
Oh yes, he's very loves to pose for pictures. When he sees the camera, he's there. But also he's extremely willing to be trained to be a good boy, to sit and wait, and follow directions. So we're very happy. Plus, I will tell you, I should have had another picture up. He has a little boy who's a best friend. They're both 5 years old. And it's wonderful to see them together. And especially during COVID, for this little boy to have a best buddy to play with. And the dog, when his little buddy, whose name is Wilshire, is walking him, Prince, the dog, does not pull whatsoever. Prince is 75 pounds and the little boy is 35. And they just have such a wonderful communication together. So I'm very excited. It makes us all feel good, much, much better than it would have been without him. And I am enjoying this program. Thank you.
Thank you so much.
I would like to talk about my Belgian sheepdog. I'm going to attempt to show you her video. I don't know if I can do the camera video thing here, but actually I don't know how you do that. I don't know. Wait, I just have to turn the camera.
You have to share your screen, but I don't know if you can do that on a phone.
Okay, well, never mind then. She's a Belgian sheepdog. She looks like a black wolf. She's helped me enormously with this COVID bit and then all the political strife we've had in this country. Just enormously. She has her baggage because she has inflammatory bowel disease and she has anxiety from that. So, but my first one, I actually did, I did do, with my last Belgian sheepdog, we did therapy dog work at Sibley Hospital. We had to pass a very, very, very difficult test. Only 6 of the 32 dogs that passed, that were there for the testing on a particular day passed. It was my dog and 5 corgis. But anyway, it was wonderful going from room to room with the patients and seeing them. And one patient was really at death's door. The nurse told me, ask your dog to curl up beside her. So I was scared, but I believed the nurse knew what she was doing. And my dog just instinctively, ever so gently, laid beside her and put her little muzzle on the woman's chest, and here's this woman just ready to check out, and you could see a little bit of life and a little bit of happiness coming across her face. It was a very, very moving moment. So I'm really for the therapy dogs in the hospitals and anywhere else. The one I have now, there's a lot of distraction that they can help you with. It was nice to be distracted from bad news and from the scare of COVID and so on. She's just been, the one I've got now, just been very, very helpful with all of that. I don't know if I can maybe pull up a picture. That would be maybe better than, I don't know if I can do that. I don't know. Well, I guess not. I'm not good at this. All right. I'll just let somebody else speak. Thank you.
And thank you so
for sharing
much.
that story.
Yes.
That was beautiful.
I think we have time for one more. I believe I saw Curry.
Yes, hi, I'm Curry.
Yeah. Yes, go ahead.
You muted yourself, Curry.
I can't see the screen either, but
You're good now.
Can you see me now?
Yes.
Okay, because the most important thing is that you can see Clark. This is Clark. I can't see what he's doing because for some reason I have the screen that says questions are the path, whatever.
We can see him. Clark is cute.
I think you hit the mute button by accident.
Oh, I did. All right, now we won't do
Very good.
anything else wrong. Clark is a certified therapy cat in Fairfax County. It was his vet that recognized that he was not like, whatever percentage of cats. I mean, you can see him. He just wants to give me a kiss. Now, of course, he's going to want to get down. But he would get up on the counter with the vet and literally get between her keyboard and her computer screen. His brother, they were found abandoned in a dumpster, is just under the table in terror. So Dr. Pericak said, I think, I said, what can we do with this? He's kind of a Dennis the Menace and gets into trouble. He's looking for stuff to do, eat, he's kind of into chewing spatulas and cords and everything else. So we just I said, do you think he could be a therapy cat? And she said, yes. So I think it was Anne was talking about, or someone was talking about their dog passing the test. It's a very rigorous test, and they pull his tail and they, do all kinds of stuff and drop pills, move stuff around. And he was totally sedentary and passed, but they don't have any other cats. We usually go to Goodwin House, which is in Fairfax County here in Virginia, pre-COVID, and he would go to the second floor where there were people that were confined to the floor, and he would get on the bed and sit with folks or whatever, and it was really a joy. He's enjoyed COVID a lot because his family's home, and for some reason he wants to get down. He's a regular at Luann's Reiki group every afternoon. He also goes to Qigong, and he's just a joy to have. So I can attest that it's great, and they are very intuitive. I have a picture of him, which I wish I could put up. A friend of mine asked that he come see a stroke victim that was her cousin, and he intuitively went and lay on her side where she had the stroke, which was just absolutely amazing. And she couldn't speak, but the look on her face was just joy to have this animal comfort her. And so we haven't been allowed to come back yet, but as soon as we are, he looks forward to it as I do. So thank you.
Thank you so much. And this helps us recognize that there's a lot of great programs out there outside of healthcare that pet therapy works with. I have a neighbor who has a specific type of lab that's like the larger one, and she takes him to the public library, and he is present with special needs kids to help reduce their anxiety, to focus on learning to read. There's a lot of different great opportunities for pet therapy.
So I would like to take him to Children's Hospital, but in other places, but because he's a cat and people are allergic, I've tried because he is just so incredibly just gregarious. But, you know, it's sad. If we could get some treatment so that he could not be, you know, making people allergic, maybe that could happen. But he will come when he's called. I mean, he has no idea that he's a cat. So if you have an animal that is unique, see what you can do. I mean, there's other, in Fairfax, or Google Fairfax Pets on Wheels, because they do have, I can't think of what it is, but I know that, I want to say it was a tiny pony that somebody had, you know, and so they do accept, I mean, maybe they have birds, things like that, but, you know, it just brings joy to the residents at these facilities, as you've discussed.
All right. I finally figured out how to show my dog. So here she is, and her name is Joy. Joy, put your ears up. There you go. There you go. She's licking me like crazy. Joy, Joy, Joy. There you go. Okay.
And thank you so much for sharing. And Curry, thank you so much for sharing as well. So I really appreciate everyone being here today. This was a great session, and I'm looking at the chat and I'm reading everything there as well. So thank you again. And I know we're at the over the top of the half hour, so the hour, I want to call it that. And so thank you again.
Thank you, everyone. Thank you for having us today.